Seasonal affective disorder, SAD, known in specialized psychiatric texts as seasonal affective disorder and abbreviated as SAD, is a distinct type of depression that manifests with a regular and predictable pattern of onset during specific times of the year. This disorder is more prevalent, particularly during the autumn and winter seasons, when the amount of sunlight significantly decreases. The close link between this type of depression and seasonal changes in the amount and intensity of sunlight distinguishes it from other mood disorders. Consequently, in regions of the world that experience long, dark winters with short days, the prevalence of seasonal affective disorder is considerably higher. Core features and clinical signs of seasonal affective disorder. Seasonal affective disorder is accompanied by a set of specific signs and symptoms that appear at certain times of the year and improve with the change of seasons. Some of the main characteristics of this disorder include timing of symptom onset. Symptoms typically begin with a reduction in daylight hours and the intensity of sunlight in late autumn and continue until early spring, with the gradual increase in light. While the classic pattern of SAD is winter-related, there are also rarer cases where depressive symptoms appear in the summer, known as summer SAD. This summer type may be associated with different symptoms, such as insomnia, decreased appetite, and anxiety, key and predominant symptoms. Individuals with winter seasonal affective disorder often complain of excessive sleepiness, hypersomnia, increased appetite, especially a strong craving for carbohydrates and sugary foods, decreased energy levels, and a feeling of heaviness and sluggishness in the body. Additionally, withdrawal from social activities and gatherings, loss of motivation to perform daily tasks, and experiencing a depressed and sad mood on cold and cloudy days are other common symptoms of this disorder. A more detailed analysis of seasonal affective disorder using specialized indicators of depressive disorders. For a deeper understanding of seasonal affective disorder, it can be examined using specialized indicators employed in the diagnosis and differentiation of various types of depression. Severity of symptoms. The severity of symptoms in seasonal affective disorder can range from mild to severe. In moderate to severe cases, these symptoms can significantly impair an individual's daily functioning in various areas of life, including work, studies, and social relationships, necessitating specialized therapeutic interventions. Duration of symptom onset. A prominent feature of seasonal affective disorder is its cyclical and recurrent nature each year. If this seasonal pattern of symptom onset is observed for 2 consecutive years or more, the diagnosis of seasonal affective disorder, SAD, will be definitive. Temporal pattern of onset. The pattern of symptom onset in SAD is entirely dependent on seasonal changes, and specifically linked to the reduction in natural sunlight. In the Northern Hemisphere, this period typically begins in the fall and peaks in the winter. Type of psychological symptoms. Psychological symptoms in seasonal affective disorder include a deep and persistent feeling of sadness, loss of interest and pleasure in activities that were previously enjoyable, feelings of anxiety and tension, irritability, and in more severe cases, suicidal thoughts may also occur. Accompanying physical symptoms. In addition to mood symptoms, individuals with SAD often experience specific physical symptoms, including an abnormal increase in sleep duration, hypersomnia, increased appetite and a strong craving for high-calorie and carbohydrate-rich foods, unwanted weight gain, a feeling of chronic fatigue and lethargy, and vague bodily aches. Age of onset. Seasonal affective disorder typically manifests in late adolescence or early adulthood. Studies have shown that this disorder is more common in women than in men. Underlying physical conditions. The presence of certain chronic physical illnesses can affect the severity of seasonal affective disorder symptoms. For example, individuals with hypothyroidism or chronic fatigue syndrome may experience more severe symptoms of SAD. Presence or absence of psychotic symptoms. Typically, psychotic symptoms such as delusions and hallucinations are not seen in seasonal affective disorder. However, in very severe and untreated cases, there is a possibility of delusional thoughts or mild hallucinations. Mood swings. Mood fluctuations occur in SAD, but unlike bipolar disorder, signs of mania or hypomania are often not observed, except in cases of seasonal bipolar disorder. Response to medication and psychotherapy. Fortunately, seasonal affective disorder responds well to various treatments. Light therapy, phototherapy, which involves exposure to high-intensity artificial light, is one of the most effective treatment methods. Additionally, the use of antidepressant medications, particularly selective serotonin reuptake inhibitors, SSRIs, and psychotherapeutic approaches such as cognitive behavioral therapy, CBT, play a significant role in improving symptoms. Impact of environmental stimuli. The decrease in the amount and intensity of sunlight, the cooling of the weather, and the shortening of daylight hours are the most important environmental stimuli that play a role in the onset and exacerbation of seasonal affective disorder symptoms. Behavioral characteristics. Behavioral changes in individuals with SAD can include withdrawal from social interactions, decreased productivity at work or school, and in some cases, irritability and severe impatience. Cognitive changes. Cognitively, individuals may experience decreased concentration and attention, feelings of worthlessness and guilt, impaired decision-making processes, and an overall decline in mental performance. Specific symptoms: a strong craving for sweet and starchy foods, significant weight gain during the autumn and winter seasons, and excessive daytime sleepiness are specific symptoms that help in the diagnosis of SAD. Presence or absence of motor symptoms. In some cases, slowed movement and decreased physical activity levels may be observed in individuals with SAD, but these symptoms are usually not as severe as what is seen in catatonic depression. Influence of genetic and familial factors. Evidence suggests that a family history of depression or seasonal affective disorder can increase an individual's risk of developing the disorder. Therefore, genetic and familial factors play a role in susceptibility to SAD. Emotional state after onset. A prominent feature of SAD is that with the arrival of spring and the increase in sunlight, a complete improvement in the individual's emotional state usually occurs. However, without proper treatment, the likelihood of symptom recurrence in the following autumn and winter is very high. Symptoms associated with other mental disorders, seasonal affective disorder, can occur simultaneously with other mental disorders such as generalized anxiety disorder, obsessive-compulsive disorder, and sometimes bipolar disorder. The simultaneous diagnosis and treatment of these disorders are of high importance. Patients' social and economic status. Factors such as loneliness and lack of social support can increase the risk of developing depression, including SAD. Individuals lacking sufficient social support may face greater challenges in coping with the symptoms of this disorder. How symptoms manifest and are reported. Interestingly, some patients may initially present their seasonal affective disorder symptoms as nonspecific physical complaints, such as chronic fatigue, muscle pain, or headaches, and overlook their connection to seasonal changes. Conclusion and recommendations. Seasonal affective disorder is a treatable mood disorder, and its accurate and timely diagnoses can significantly help prevent complications and improve the quality of life for affected individuals. The use of light therapy, increasing physical activity in outdoor spaces, and exposure to natural light, even on cloudy days, taking antidepressant medications under the supervision of a specialist, and utilizing effective psychological methods such as cognitive behavioral therapy are among the most important and effective strategies for controlling and managing this disorder. If you or someone you know regularly experiences symptoms similar to those described during the autumn and winter seasons, or if these symptoms lead to impairment in your daily functioning, it is strongly recommended to consult a psychiatrist or psychologist for a thorough evaluation and specialized guidance. Early diagnosis and appropriate intervention can prevent the progression of symptoms and their negative impact on an individual's life. To gain more information and access educational content in the field of mental health and mood disorders, we invite you to join the Mental Today channel.